Chapter 12. The gastrointestinal system. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note. Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting dullness, percos, percos, or that first with the patient lying supine flat on their back. Then ask the patient to lie on one side and percos again. If fluid is present, the dull, note, heard, or percussion moves. Palpate each region, feeling for tenderness pain when touched, or masses. Pal, palpable, palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, how, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpitating hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds. Deficits. There are several words for deficits. Doctors sometimes say, there was blood in the stools. Have you passed black stool? Patients sometimes say, my motion have been very loose lately. Bowel movements is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of the defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, be constipation, heart, infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid unformed. The consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, so soft, loose, liquid, watery. The color can vary from black due to altered altered blood as in melena to yellow, gray, or even white. Melena stools are often described as tar, tar-like tar, the black sticky substance that is used in road making. The stools may be red when fresh blood is present, blood that can only be detected with special tests is called fecal, occult blood, FOV. When there is a high fat content, these stools are pale and are sometimes described as clay colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Complete the case report. Look at A opposite to help you. Case 14. 14. Physical examination revealed a thin girl with slight pallor. She was not obvious, ob- obviously dehydrated. The temperature was 38 degrees Celsius, pulse 100 per minute, blood pressure wanted over 80 millimeters of mercury. Examination of the rest of the car- cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant, and was associated with guarding but not rigidity. There was no rebound tenderness, and no masses were felt. Vowel sounds were reduced. Match the description of the stool 1 to 6 with the condition most likely to cause then F to F using your medical knowledge. Look at the opposite to help you. Types types of stool and condition. Loose, bloody, bloody. C. Ulcerative colitis. 2. Loose, fairly bulky. E. Celiac disease. 3. Clay colored. F. Obstructive jaundice. 4. Black tarry. A. Gastric ulcer. 5. Small heart. B. Irritable bowel syndrome. 6. Clear watery with mucus. D. Cholera. Match the fracture 1 to 7 to the doctor question. Look at the opposite to help you. 1. Blood. F. Have you passed black stools? 2. Bowel habit. A. How often do you open your bowels? 3. Change in bowel habit. B. Are you going to the toilet more often than normal? 4. Bulk. G. Is the size or the amount of the stool normal? 5. Color. F. What about the appearance of the stools? 6. Consistency. C. Are the motion hard or loose? 7. Offensiveness. D. Do the emotion have an unusual smell? Right upper quadrant. Left upper quadrant. Right lower quadrant. Left lower quadrant. Over to you. Look back at 20 points to above. In what other conditions that you encounter regularly Is the appearance of the stools typical? How would you describe their appearance? In cholera, stools are watery and clear. In ulcerative colitis, they are loose and bloody. Now, in Spanish, el sistema gastrointestinal, exploración del abdomen. Aquí hay un extracto de la descripción de un libro de texto sobre cómo examinar el abdomen. Observe si el abdomen está distendido por líquido o gas. La presencia de líquido se puede determinar demostrando matices cambiantes, percusión o golpeteo. Primero con el paciente acostado boca arriba. Luego pídale al paciente que se acueste de lado y vuelva a percutir. Si hay líquido presente, el sonido que se escucha al percutir se mueve. Palpe toda la región abdominal sintiendo si hay dolor al tacto o masas. Palpables, agrandamiento palpables, agrandamiento del tejido. Observe también cualquier defensa o rigidez mostrada por la contracción de los músculos abdominales. La defensa puede deberse a miedo o ansiedad y se puede reducir si se persuade al paciente a relajarse. La rigidez, sin embargo, es constante y se debe a la peritonitis. El dolor de rebote es dolor cuando se retira repentinamente la mano que palpa. Escucha los ruidos intestinales. Parte B. Las heces. Hay varias palabras para las heces. Los médicos a veces dicen, había sangre en las heces. ¿Has evacuado heces negras? Los pacientes a veces dicen, mis disposiciones han sido muy sueltas últimamente. La evacuación intestinal se utiliza para referirse a la defecación. ¿Has evacuado hoy? ¿Has evacuado hoy? El hábito intestinal es una expresión médica que significa el patrón de defecación. ¿Has notado algún cambio en tus hábitos intestinales? ¿Con qué frecuencia evacúas? ¿Vas al baño con más frecuencia de lo normal? Un cambio en los hábitos intestinales podría ser estreñimiento, heces duras e infrecuentes o diarrea, heces blandas o líquidas frecuentes. Las heces normales son de color marrón y semisólidas o formadas. La consistencia o grado de dureza y blandura se puede mostrar en una escala. Las duras, las formadas, las semisformadas, las blandas, sueltas, líquidas o acuosas. El color puede variar de negro debido a la alteración de la sangre, como en la melena o amarillo, gris o incluso blanco. Las heces de melena a menudo se describen como alquitranadas, como el alquitrán, la sustancia negra y pegajosa que se usa en la construcción de carreteras. Las heces pueden ser rojas cuando hay sangre fresca presente. La sangre que solo se puede detectar con pruebas especiales se llama sangre oculta en las heces. Cuando hay un alto contenido de grasa, las heces son pálidas y a veces se describen como de color arcilla. Las heces de gran volumen se describen como voluminosas. Un mal olor se describe como fétido u ofensivo. Thank you.